this discussion, this fight over what to do about reforming health care has been going on now for a year. Question is, what will it take to close this deal? Kelly O'Donnell's in our Washington bureau tonight with more on that part of the story. Kelly, good evening.
That's really it, Brian. What can come of this summit? So much of the attention's been about finding a way for Democrats and Republicans to work together on health care reform. But the pressure is really on Democrats. The test is whether they can trust each other's promises to get something passed. While the president was host and referee today,
Nancy?
Speaker of the House Nancy Pelosi must be the closer.
What we do here must be relevant to their lives. The yeas are 218.
Why? Under the rules, the House needs to take the next step, voting on the Senate's version of health care reform before taking up the fixes talked about today. And that's a very hard sell. No Republican will vote for it.
We just can't afford this. I mean, that's the ultimate problem here.
And Democrats in the House do not all agree. Their internal party differences could be enough to derail reform. The issues? Cost.
If the cost issue is legitimate and whether we can afford it or not, we'll be discussing that.
A package estimated around $900 trillion over 10 years. That's too expensive for a group of about 50 conservative-leaning Democrats.
Health inflation is driving us off a cliff.